So before we formally start, I would like to take few names, few partners who have been very instrumental behind this campaign. And beginning with our partners Parmarth Niketan Ashram Rishikesh. All this started when we took the first steps for this Faith for Harm Reduction manual about 2 years ago on the World Mental Health Day. And if not for Parmarth Niketan's leadership, we wouldn't have come this far. So thank you, Parmarth Niketan. Thank you, Swamiji. Thank you, Sadhviji. And thank you, Swaminiji. Thank you, Ahimsa Vishwa Bharati. Thank you, Ajmer Sharif Dargah. Thank you, all India organizations of Imams of Mosques. Thank you, Art of Living. Good morning, Dr. Machin. Good morning, sir. Thank you, Swami Narayan Sanstha. Thank you, Brahma Kumaris. Thank you, Caritas India. Thank you, CPS International. Thank you, Divya Jyoti Jagriti Sanstha. Thank you, Jiva Global Interfaith Wash Alliance. Thank you, Mata Amritanandmayi Institute. Thank you, Religion World. Thank you, Srimad Raj Chandra Dharampur, Sri Bangla Sahib Gurdwara Committee, the Office of His Holiness Drikung Kyabong Chetsan, and the Temple of Understanding. Dr. Machin, you just joined us. Thank you, sir, for being in person. Before we actually move on to inviting our special guest for the day to speak on the occasion, I just wanted to share a few words on behalf of Alliance India and URI. I'm deeply honored and privileged to host you for this important meeting on behalf of URI, the Faith for Harm Reduction Partnership, and Alliance India for two main reasons. We are witnessing a revolution in practice, a revolution which brings together people who use drugs, human rights advocates, public health practitioners, and of course, those who have perhaps the biggest influence to make a difference, our faith leaders, to address a pressing problem for which there are straightforward, evidence-informed solutions. I'm grateful to our faith leaders and faith-based organizations who have been part of the journey of developing the Faith for Harm Reduction manual. Secondly, being here provides me and all of us from URI and Alliance India an opportunity to publicly acknowledge the work of our partners. Please allow me to congratulate all our faith leaders, Parmarth Niketan in particular, for the leadership when we just began, and in helping us bringing together stakeholders to explore a deeper role for the faith community. Since that first meeting on the World Mental Health Day almost 2 years ago, we saw the faith community of India speak in one voice about 4 interrelated themes. First one was harm reduction as part of the renewed push for universal access to HIV prevention, treatment, care, and support, and other health concerns. Laws which prevent drug users from access to harm reduction and health measures are counterproductive to any health response. Backing human rights approaches to harm reduction and people who use drugs. And importantly, bringing the harm reduction community to a renewed global movement to deliver the results we need. This is very important as drug users are forced to choose between TB treatment, drug substitution therapy, HIV and hepatitis C treatment because services are not integrated. And the newly emerging drug use hotspots where drug use has followed changes in drug trafficking routes, harm reduction programs are still largely lacking. Unacceptable human rights abuses of drug users continue to be reported everywhere and even more during this ongoing pandemic. We know from study after study across the world and in India that police crackdowns on drug users have massive negative health consequences, and this too must stop. We know the programs work best when communities most affected are involved in shaping those programs. Today, I want to salute the courage of those advocates who've been willing to come forward, like my good friend Charan here, Bobby here, as people who use drugs, often at considerable personal risk. Working with, not against, drug users is how we can make universal access a reality. The challenges are real, but the faith community on our side makes it possible. Before we begin with the formal speeches from our dignitaries, let me finish with four interlinked imperatives: universal access, human rights, a revitalized community, and faith led movement for the full inclusion of drug users in the drug use response. Let's join hands to make real progress on all four. I know it's possible, and thank you. Uh, we would now like to begin with the formal speeches, and I'm very honored to invite Mr. Ashim Chawla, RC, our Chief Executive for Alliance India, who's not with us but has sent his opening remarks.
Hello, good morning and welcome to this wonderful gathering. My name is Ashim and I work as the Chief Executive of Alliance India. I am truly sorry for not being with you in person. It's very unfortunate that I had something else very important that came up, but I'm pleased to join you through this video link. I hope you have a wonderful time as we launch the Faith for Harm Reduction manual. I'll just say a few words at the start of this event. Our experience has shown us that communities rely on faith institutions as the major coping mechanism during disasters, pandemics such as the one that we are facing at the moment, and they share compassion and they offer hope and courage. So faith leaders become extremely important, especially in the context of crisis, the kind of crisis that we are in today. I'm therefore very, very proud of our amazing partnership with the United Religions Initiative and all other stakeholders in the Faith for Harm Reduction campaign, which is of course supported by the Global Fund. People who use drugs are at an increased risk of morbidity and mortality linked with HIV and AIDS, hepatitis, mental health, overdose, and drug dependence. And this is something we know. We also know that social stigma, discrimination, and other structural barriers prevent people who use drugs from accessing proper health care and HIV and harm reduction services. And this obviously impedes their ability to get the right services at the right time. So this campaign is really aimed at making sure that we are able to somehow remove the barriers for people to access the services. And I would say that the role of faith and religion is extremely important for awareness of others as well, for awareness by people who would otherwise criminalize or discriminate. And therefore, I'm extremely grateful to the faith leaders who have decided on their own to become part of this campaign. I truly congratulate each of you for your non-judgmental and brave attitudes. Finally, I want to say, join us in our movement to become a Faith for Harm Reduction champion, and please support, don't punish. Support, don't punish. Thank you.
So we are indeed privileged to invite you, Alice. We just introduced you, and you may please go on, please.
I beg your pardon. Thank you so much. It is my privilege to be here with you today. My name is Alice Sweat, and I serve as the Director of Global Programs for URI. I'm joining you today from San Francisco, California in the US. I'm so pleased to be here to help celebrate the launch of the manual of the Faith for Harm Reduction initiative. This important initiative involves institutional partners working together to address the critical public health issue of drug use. It aims to ensure comprehensive access to prevention and treatment for people who use drugs. Every religion has at its core spiritual values that encourage the care of those who are sick, marginalized, and oppressed. Religious traditions urge all people to recognize the divine spark in each and every person and to reach out in compassion and support as a sacred act of service. Leaders of religious communities and institutions have an opportunity and a responsibility to recognize and uplift the inherent dignity in every human being, regardless of the path they walk. I salute and applaud the varied faith community leaders who have stepped out to embrace faith for harm reduction. You are a model for the rest of society, demonstrating inclusion and showing how critical it is to provide systematic, safe approaches to education, treatment, and care. My hope is that many others will follow your lead. I am particularly grateful to our colleagues at Parmarth Nikitan Ashram for their steadfast support of this important work. URI has a long history of engaging issues related to drug use and abuse, in particular, the care of those suffering from HIV and AIDS. As a global network of people of all beliefs, URI was created by grassroots members from all over the world, including in India, to engage people of all religions, spiritual expressions, and indigenous traditions in upholding specific values. These values are reflected in the Faith for Harm Reduction initiative, and they include uniting for the good of everyone, using practices that do not discriminate, working for healing and reconciliation, and creating cultures of peace, justice, and healing for the earth and for all living beings. It's an honor for URI to be a part of this extraordinary coalition of organizations from across society dedicated to this pressing issue. And it's an honor for me to be here with you all today. Congratulations to you all on this important work.
Okay. So moving forward, as I mentioned earlier, Faith for Harm Reduction as a campaign was born out of conversations with communities of faith, harm reduction organizations, and network of people who use drugs, but also to engage other stakeholders who have a very pivotal role to play in the whole harm reduction response. So this campaign fills in as a unique role of a convener, a community mobilizer, and capacity builder, fostering innovative and previously untapped cross-sector collaborations to expand and strengthen harm reduction in principle, practice, and policy. For this reason, we have also got with us prominent lawmakers, politicians from key states of India, who in their own way have been more severely affected by health consequences and social consequences of drug use, perhaps more than the others. But we also have champions, Faith for Harm Reduction champions, some of whom are not here, but have shared their good wishes with us through videos, and we would request our team to put them on. To begin with, I would like to request our team to share the good wishes of Mr. Rana Gurjeet Singh, former cabinet minister and MLA of the Congress party from Kapurthala, Punjab. This is where we also have a unique harm reduction program for women who use drugs. We've often been in denial about whether this problem at all is linked with women, but it's big and we need to be serious about it. So we brought in our MLA to talk about this.
ਭੈਣੋ ਅਤੇ ਭਰਾਓ, ਅੱਜ ਮੈਨੂੰ ਬੜੀ ਖੁਸ਼ੀ ਔਰ ਮਾਣ ਮਹਿਸੂਸ ਹੋ ਰਿਹਾ ਕਿਉਂਕਿ ਮੈਂ ਕਪੂਰਥਲੇ ਦਾ ਚੁਣਿਆ ਨੁਮਾਇੰਦਾ ਹਾਂ। ਇਹਦੇ 'ਚ ਪੋਲੀਟੀਕਲ ਅਟੈਂਸ਼ਨ ਦੇਣੀ ਜ਼ਰੂਰੀ ਹੈ ਜਿੱਥੇ ਇਲਾਜ ਜ਼ਰੂਰੀ ਆ। ਅਤੇ ਅੱਜ ਅਗਰ ਵੇਖਿਆ ਜਾਵੇ ਤਾਂ ਬਹੁਤ ਸਾਰੀਆਂ ਬਿਮਾਰੀਆਂ ਜਿਵੇਂ ਡਰੱਗ ਹੋ ਗਈ, ਹੈਪੇਟਾਈਟਸ ਹੋ ਗਈ, ਹਾਂਜੀ ਏਡਸ ਹੋ ਗਈ। ਅਲਾਇੰਸ ਇੰਡੀਆ, ਯੂਨਾਈਟਿਡ ਰਿਲੀਜਨ ਇਨੀਸ਼ੀਏਟਿਵ, ਉਹਨਾਂ ਦੀ ਪਾਰਟਨਰਸ਼ਿਪ ਨਾਲ ਫੇਥ ਕਮਿਊਨਿਟੀ ਤੇ ਅੰਡਰ ਯੂਨੀਕ ਟਾਈਟਲ, ਇਹਦਾ ਟਾਈਟਲ ਦੇ ਰਿਹਾ ਫੇਥ ਹਾਰਮ ਰਿਡਕਸ਼ਨ। ਇੱਕ ਕੰਪੇਨ ਹੋਏਗਾ, ਗਲੋਬਲ ਫੰਡ ਉਹਨੂੰ ਇਹ ਕਰਨਗੇ ਸਪੋਰਟ। ਐਂਡ ਇਹ ਛੋਟੀ ਨਹੀਂ ਬੜੀ ਵੱਡੀ ਗੱਲ ਹੈ। ਔਰ ਕਪੂਰਥਲੇ ਦੇ ਵਿੱਚ ਬੜੇ ਲੰਬੇ ਅਰਸੇ ਤੋਂ ਡਰੱਗ ਦੇ ਉੱਤੇ ਬਹੁਤ ਵੱਡਾ ਕੰਮ ਡਾਕਟਰ ਭੋਲਾ ਜੀ ਨੇ ਸਿਵਲ ਹਸਪੀਟਲ 'ਚ ਕੀਤਾ, ਔਰ ਉਹਦੇ 'ਚ ਸਾਡੇ ਹੋਰ ਡਾਕਟਰਸ ਦਾ, ਨਰਸਿਸ ਦਾ ਔਰ ਉਹਨਾਂ ਦਾ ਬੜਾ ਵੱਡਾ ਇੱਕ ਯੋਗਦਾਨ ਰਿਹਾ। ਅਤੇ ਇਹ ਦੇਖੋ, ਇਹ ਜਿਹੜਾ ਡਰੱਗ ਦੀ ਓਵਰਡੋਜ਼ ਆ, ਇਹਦੇ ਬੜੇ ਨੁਕਸਾਨ ਹੈ। ਮੋਰਟੈਲਿਟੀ ਇਹਦੇ ਬਣਨ ਦੇ ਚਾਂਸਿਸ, ਡਰੱਗ ਔਰ HIV, ਏਡਸ, ਹੈਪੇਟਾਈਟਸ, ਮੈਂਟਲ ਹੈਲਥ, ਓਵਰਡੋਜ਼, ਡਿਪੈਂਡੈਂਸ, ਜ਼ਿਆਦਾ ਡਰੱਗ ਜਿਹੜੇ ਲੋਕ ਇਸਤੇਮਾਲ ਕਰਦੇ ਆ, ਉਹਨਾਂ ਨੂੰ ਸਾਡੇ ਸਮਾਜ ਨੇ ਸਪੋਰਟ ਕਿੱਦਾਂ ਕਰਨਾ। ਇਹ ਇੱਕ ਸੋਸ਼ਲ ਸਟਿਗਮਾ ਵੀ ਮੰਨਿਆ ਜਾਂਦਾ ਡਰੱਗ। ਅਤੇ ਜਿੱਥੇ ਦਵਾਈ ਦੇਣੀ ਜ਼ਰੂਰੀ ਆ, ਉੱਥੇ ਕਮਿਊਨਿਟੀ ਦੀ ਸਪੋਰਟ ਵੀ ਉਸ ਇਨਸਾਨ ਨੂੰ ਬੜੀ ਜ਼ਰੂਰੀ ਆ। ਇਹ ਉਹ ਪ੍ਰੋਗਰਾਮ ਹੈ। ਔਰ ਇਹਦੇ ਵਿੱਚ ਮੈਨੂੰ ਦੁੱਖ ਦੇ ਨਾਲ ਕਹਿਣਾ ਪੈ ਰਿਹਾ ਕਿ ਸਾਡੇ ਛੋਟੇ ਛੋਟੇ ਬੱਚੇ ਔਰ ਫੀਮੇਲਸ ਵੀ ਇਹਦੀ ਲਪੇਟ 'ਚ ਨੇ, ਔਰ ਘਰਾਂ ਦੇ ਘਰ ਤਬਾਹ ਹੋ ਰਹੇ ਆ। ਸਾਨੂੰ ਅੱਜ ਲੋੜ ਹੈ ਕਿ ਸਾਰੇ ਜਣੇ ਆਪਾਂ ਅਲਾਇੰਸ ਇੰਡੀਆ ਗਲੋਬਲ ਫੰਡ ਜਿਹੜਾ ਇਹਦਾ ਇੱਕ ਪਾਰਟ ਆ, ਸਾਡੇ ਹੌਸਪੀਟਲ ਦੇ ਨਾਲ ਰਲ ਕੇ ਇਹ ਪ੍ਰੋਗਰਾਮ ਨੂੰ ਚਲਾਉਣਾ ਚਾਹ ਰਿਹਾ, ਆਪਾਂ ਸਾਰੇ ਸਪੋਰਟ ਕਰੀਏ। ਐਂਡ ਮੈਨੂੰ ਬੜਾ ਮਾਣ ਵੀ ਮਿਲਦਾ ਔਰ ਮੈਨੂੰ ਪੂਰਾ ਭਰੋਸਾ ਕਿ ਇਸ ਮੂਵਮੈਂਟ ਦੀ ਜਿਹੜੀ ਚੈਂਪੀਅਨ ਜਿਹੜਾ ਬਣੂਗਾ, ਇਹ ਫਾਈਨਲੀ ਸਪੋਰਟ ਕਰੂਗਾ ਔਰ ਇਹ 'ਚ ਕੋਈ ਕਿਸੇ ਪ੍ਰਤੀ ਸਾਨੂੰ ਪਨਿਸ਼ਮੈਂਟ ਨਹੀਂ ਦੇਣੀ ਚਾਹੀਦੀ।
Committed to provide support to those who use drugs, who are desirous and who seeks genuinely to lead a healthy life. We want to ensure that harm reduction program, detoxification, rehabilitation, mainstream and social integration or reintegration is provided by creating an atmosphere that respects his or her rights as an individual and by providing options for secure livelihoods and strong information and support systems. This has been put in place by the state government. The Nagaland state government has provided the political leadership by approving the Nagaland State Substance Abuse and Prevention and Treatment Policy in 2006. This is to ensure that there is a collective response to the aforesaid program and to implement effectively that program. The state government, in recognizing the importance of a meaningful engagement of communities and civil societies, have also constituted the Committee of Concern under the chairmanship of the State Chief Secretary, Nagaland. We have appealed to everyone to put in their best efforts so that we create a supportive system for those who are in need. The Nagaland government is committed to provide support to those who use drugs, who are desirous and who seeks genuinely to lead a healthy life. We want to ensure that harm reduction program, detoxification, rehabilitation, mainstream and social integration or reintegration.
Moving forward, it's my honor and privilege to now invite Mr. Langpoklapam Jayanta Kumar Singh, former health minister and sitting BJP MLA from Manipur, to talk about his views on the meeting we are having today. Can I request the team to play it?
Fed for Harm Reduction Program, an initiative undertaken by Alliance India, United Religion Initiative and the other partners from my state, that is Manipur. As the world goes on tackling COVID-19, it has become even more important for communities to rely on the FED and the FED institutions as a coping mechanism. As we know, local FED institutions have the ability to leverage considerable resources in humanitarian response, including helping in the fight against drug abuse. In Manipur, we have a popular saying that Hakjang Fabne Lanne, which translates to say that health is wealth. Religious institutions in Manipur, such as Saramaism, propagates healthy living free of drugs and abusive substances. It is believed that when one's Hakjang is clean, he will achieve true happiness. And community belief says that the human body itself is a temple which always calls for cleanliness, purity, and protection of any other harmful elements. It is only when one can attain such a stage that he can be truly healthy, both mentally and physically, and live longer, thus paving a way to achieve the ultimate reality that is God. Another major contribution of FET is yoga, which itself means the union. That is the union of body, mind, soul, and spirituality together. It has been noted that 90% of drug users are mainly due to stress, and as such, stress management through yoga is one of the effective ways. Meditation helps to bring our mind in tranquil state. Pranamaya, that is breathing exercises of yoga, help in controlling mind and increase the healing power inside the body itself.
I just wanted to share recent last 4 or 5 years of reports concerning drug users. If you see what are the major reasons why drug users continue to be left behind, there are 3 prominent reasons. We are addressing one, which is stigma and related structural barriers that prevent people from accessing health services. We also have policy and legislative issues, and that is where the commitment and role of our political leadership is so critical. Another very important aspect, quite interestingly, is also financing. Drug use and drug use related health consequences attract the least amount of funding when it comes to stigmatized or discriminated populations. And therefore, to reinforce the commitment, we have Ms. Nicole Delaney from Global Fund to talk about Global Fund's commitment to this campaign, and most significantly, to also assure us that for the good work that we would perhaps be able to do with this, I believe we would be able to do with this through this campaign. Global Fund's commitment is always with us.
Hello, my name is Nicole Delaney. I am a Senior Fund Portfolio Manager of the Global Fund to fight AIDS, tuberculosis and malaria, and I have the pleasure of working together with HIV Alliance and a number of other partners through Asia, funding regional harm reduction advocacy efforts. So a big hello to all of our harm reduction advocates and supporters here today. We are joined today to champion the Faith for Harm Reduction movement and specifically to celebrate the launching of a Faith for Harm Reduction manual to support and expand our advocacy efforts for drug users. We need to remember and highlight that people who use drugs are at increased risk of diseases such as HIV/AIDS, hepatitis, mental health problems, overdoses, and drug dependence. We need to emphasize that stigma and discrimination in our societies and other structural barriers prevent our brothers and sisters who use drugs from accessing health, HIV, and harm reduction services. The efforts of our movement are directed to removing these barriers. Unfortunately, a poor understanding of challenges and needs linked with a lack of data has resulted in a limited consensus on minimum standards of care. The Faith for Harm Reduction movement is an effort to build consensus amongst key stakeholders, including, especially the faith community, to use data to develop humane, needs-based and community-sensitive standards of care for people who use drugs. The role of faith and religion and our leaders of faith is critical, ensuring better awareness amongst all, thereby ensuring that people who use drugs are treated equally, with their rights and dignity not violated, and to ensure that programs and policies do not leave our marginalised communities behind. Please join us in our movement and become a Faith for Harm Reduction champion. And on this special day, let's all remember to support, don't punish. Thank you.
So I think our next speaker, Mr. Chand Kaushal, is not here, but I would like to just quickly share a few thoughts. 10th October is when we started, right, Subi? 10th October is when we started this in 2018. And Mr. Kaushal was very instrumental in bringing us this far in terms of fostering a UN collaboration for this important event and for this important launch. And part of the discussion with him was how can we do it fast? Because as we continue to discuss in this meeting, since morning till now, I can assure you that there have been several overdose deaths while we are sitting here. And all the problems that we've been discussing, be it HIV, be it hepatitis, we launched the manual. I would request all of us to come forward, led by Dr. Merchant, who's been silent but very, very instrumental in always being with us, always a phone call away and leading us. Sir, please join us here. And if all of us, ma'am, please join us here. We'll do a formal launch of the manual. So we'll move to the next equally important part, and this is our opportunity to hear from the real contributors, the real leaders, the real authors, the real guide, people who have actually led to this manual being written, drafted. So we have few reflections from different people, and we'll go in one go, Subi. We'll first begin with Pujya Sadhguruji. Yeah.
In today's world, humanity suffers from various kinds of issues. All these things, essentially what it means is, in some way, we are not able to make use of the discretionary dimension of who we are. Unlike other creatures, a human being has the ability to employ his discretionary mind in such powerful ways that he can even go beyond his fundamental needs of life. The whole system of yoga, or what we are calling today as inner engineering, is essentially about gaining the ability, having the ability to employ the discretionary dimension of who we are. Discretion means that we can conduct our life the way we want it. Going beyond the situations in which we exist, a human being can still craft his own life the way he wants it. The basic process of inner engineering is to empower a human being to be able to employ his discretionary dimension in such a way that he can move his life to a dimension beyond his present level of existence.
We were talking about Parmarth Niketan, where it all started being discussed, and one of the discussion was about why people in India, for most health or social considerations, go to faith leaders before sometimes even going to doctors, and that's the kind of influence faith leaders have. So if we were to even manage to influence people to, as simple as humanizing people who use drugs and the issue of drug use, I think we'll achieve most of what is preventing the HIV response, the hepatitis response, overdose, mental health, and so on and so forth. So we'll move to the next speech by Guruji. Subi, can you please?
हार्म रिडक्शन चैंपियन के लिए विश्वास और साथ दे सजा नहीं, ये कैंपेन सचमुच बहुत ही बेहतरीन, बहुत ही बढ़िया है। ज़िंदगी का लोशन भी है और सोल्यूशन भी है, एंड टू मी यू आर द सोल्यूशन। लाइफ परीक्षा लेती है, टेस्ट लेती है, कई बार लेती है, बार बार लेती है, पर हमें हिम्मत रखना है और आगे बढ़ते रहना है। जिंदगी केवल न जीने का बहाना, जिंदगी केवल न सांसों का खजाना, जिंदगी सिंदूर है पूरब दिशा का, जिंदगी का काम है सूरज उगाना। मैं अच्छाइयाँ चुनूंगा, बुराइयाँ नहीं। बस यही तो जीवन है। बोलो जीवन कैसा है? जैसा बना लो वैसा है। चाहे इसको नरक बना लो, चाहे इसको स्वर्ग बना लो। बोलो जीवन कैसा है? जैसा बना लो वैसा है। It's in your hand. You are the power. Feel the power and fill the power in others. God bless you.
I'm so glad to know that the Faiths for Harm Reduction Manual, the training manual, is being officially launched today. I remember the wonderful meeting, conference that we had here at Parmarth Nikathon last year, bringing together faith leaders to really put our minds and our hearts and our experience and our expertise together in how to bring out a manual that would guide and inform and inspire the faith leaders and faith communities to really come together to support and not punish. And in the same way that we don't discriminate against people of any ailment, of any illness, of any disease, but rather as people of faith, we are committed and dedicated to doing whatever we can to helping them, healing them. We are called upon to help, to heal, to remove stigma and discrimination, both for the ease in their hearts as well as for the ease in access to treatment, to data, to actual logistic help for them. And so today, I'm so sorry that we can't be there physically, but we are with you in heart and spirit and commitment as this Faiths for Harm Reduction Manual is launched. And remember, support, don't punish. Our sisters and brothers of every race, every religion, every color and every creed, and suffering from any ailment, any illness, any dis-ease, they need our help, our support, our coming together. So let us connect with the power of our faith within us that reminds us we are all one family. We are all one creation, without borders, without boundaries. And let us come together for our sisters and brothers who are suffering the scourge of drug use. Together, we can be that solution. So much love to you all. Congratulations and best wishes for this manual, for this launch event, and moving forward together. And remember, we are all together in this.
फेथ फॉर हार्म रिडक्शन मैनुअल का शुभारंभ होने जा रहा है। आज ड्रग्स की एक बहुत बड़ी समस्या है और उसके कारण से बहुत सी और समस्याएं, HIV, एड्स, हेपेटाइटिस, मेंटल हेल्थ, साइकोसोमेटिक डिजीज, तनाव, डिप्रेशन, इन सभी समस्याओं के निजात के लिए धर्मगुरु और धार्मिक संगठन बहुत बड़ी भूमिका निभा सकते हैं। भारत में प्रतिदिन उपासना के स्थानों पर लाखों करोड़ों लोग मंदिर, मस्जिद, चर्च, गुरुद्वारे में जाते हैं और ऐसे में फेथ लीडर अगर अपनी भूमिका निभाए और ड्रग्स के साथ साथ सामाजिक बहिष्कार की स्थितियों से उन्हें गुजरना पड़ता है, उनके प्रति सद्भावनापूर्ण सामाजिक माहौल नहीं होता है, ऐसे में और समस्या बढ़ जाती है। आज अपेक्षा है हमें ड्रग्स की समस्या से निजात दिलाना है, किंतु उनके साथ हम उपेक्षापूर्ण व्यवहार न करें, तिरस्कारपूर्ण व्यवहार न करें, सहानुभूति और सद्भावना रखते हुए कि किस प्रकार वो मेंटल हेल्थ से उभरे और समाज की मुख्य धारा से जुड़ करके आगे बढ़े। इसके लिए यूआरआई ने, ग्लोबल फंड ने, अलायंस इंडिया ने, यूनाइटेड नेशंस डेवलपमेंट कार्यक्रम में, ऐसे वैश्विक संगठनों ने जो ये कार्यक्रम शुभारंभ किया है। और मुझे खुशी है कि अहिंसा विश्व भारती सहित सारे फेस संगठन इसमें एक साथ आए हैं। मैं अपील करना चाहता हूं अहिंसा विश्व भारती की ओर से, आइए हम इस अभियान से जुड़े, उन्हें सहानुभूति सद्भावना के साथ समाज के अंदर सम्मान का स्थान दिलाएं। इन्हीं शब्दों के साथ ओम अरहत।
जो लोग अधिकांश नशे का सेवन करते हैं वो अधिकांश बीमारियों की जद में होते हैं, जैसे HIV, हेपेटाइटिस, मानसिक स्वास्थ्य। इन बीमारियों की अधिकांश जद में वही लोग होते हैं जो नशे का सेवन करते हैं। और समाज में कलंकित होने का डर, भेदभाव उन्हें उन तमाम मूलभूत सुविधाओं तक पहुंचने में भी रोक देता है। ये तमाम बाधाएं दूर हो सकें, इसके लिए प्रयास निसंदेह होने चाहिए। परंतु कुछ जगह डेटा की कमी होती है, पर फिर भी देखभाल के न्यूनतम मापदंडों में सहमति का नेतृत्व तो होना ही चाहिए। नुकसान में कमी के लिए हम लोगों का प्रयास, या ये कहूं कि धर्म जगत का विशेष प्रयास हमेशा से सार्थक रहा है और भविष्य में भी सार्थक रहे। यही हम लोगों की तरफ से प्रयास होना चाहिए। जनता अनुयायियों के बीच जागरूकता की मुझे लगता है कि जो सबसे बड़ी कड़ी होती है वो होता है धर्म जगत। और जब धर्म जगत कोई कार्य करता है तो निसंदेह उसके प्रमाण निसंदेह हम लोगों को देखने को भी मिलते हैं। महत्वपूर्ण है धर्म जगत का योगदान, और धर्म जगत को इसमें जुड़कर अपना योगदान देना भी चाहिए। और मैं समझता हूं कि हम लोगों का योगदान ना कि सिर्फ देने भर से, इसमें आगे जुड़कर कुछ करने भर से भी होगा। मगर अंत में एक शब्द कहूंगा, इन तमाम प्रयासों में जो हार्म रिडक्शन चैंपियंस हैं उनके विश्वास बने रहें। बस एक चीज याद रखिएगा कि उन लोगों का साथ दें, उन लोगों को सजा ना दें। नमस्कार।
Thank you, Swami Dipankar ji. And before we play the next speaker, I just wanted to acknowledge that when we were witnessing the first HIV infections in India, especially in the northeastern part, it was largely because of drug use related issues. And one of the first communities to respond to that crisis was the faith community, especially the churches in the northeastern region. And it's my real privilege to invite the speech from Father Paul from Caritas India. They continue to play a very important role in the HIV response globally.
My dear friends, greetings and pranam from Caritas India. Love your neighbor is the message of every religion. Every faith response is for harm reduction. Caritas India strongly embraces and support the campaign Support, Don't Punish. I wish every success and support to this beautiful campaign for the restoration of the dignity of every human person who has gone astray from the mainstream of the society. Let's come together and be united for this cause. Thank you.
Thank you, Father Paul. You've been very strongly behind us and leading the way in terms of leading this Faith for Harm Reduction campaign. We now will take a break from the video speeches and move to the in-person speech. My privilege and honor to first invite Dr. A.K. Merchant. Sir, if you could kindly join me at the podium.
Good afternoon, ladies and gentlemen, dear friends. Very grateful to all the organizers, the United Religious Initiative, the Global Fund, the Alliance India, the harm reduction team, and all the organizing bodies that have come together, you can see how strong is the collective initiative. Have tried our best to, in some ways, contribute. So today's gathering also, although we are small, yet the way the technology has helped us to connect with all the other important persons around the world clearly shows each one of us are committed. And we know at this time of global pandemic, we are suffering from many dimensional crippling problems, especially the mental challenges, the stress that is in our homes that we are experiencing. But as we have just listened and understood that human beings go way beyond simply our physical bodies, simply our intellectual prowess. We have faith, we have belief, we know the power of religion, of dharma, to motivate. Secular and pragmatic knowledge is good. The manual actually is very wholesome because it has addressed almost all the dimensions that concern a person who gets afflicted with drugs. So I believe that this manual, the initiative that was taken, and the efforts that have been put in by all the people, I'm not naming everyone, but all the organizations involved, all the friends who have worked so hard for the past 2.5 years or so in putting together this wonderful book will have its impact, and it also be translated into other languages so that as many people as possible are able to access it. Apart from it being available digitally, and now with Microsoft language skills improving. So on behalf of the Baha'i community, we believe that every child that comes to us is potentially the light of the world. Circumstances take us to different paths, so we must never have a negative notion. As we have said over and over again, people have repeated, we need to provide love. We need to provide those forces of integration, which is the foundational teachings of all the religions. And we need to ensure that nobody simply gets punished. Because every human being in his or her life learns many things from trial and error. So from time immemorial, the religious teachings, the faith-based institutions have always tried to contribute as an alternative to the pragmatic and secular forms of knowledge and skills, a spiritual force which is so vital in everyone's life. And in India in particular, we have the ancient culture and tradition. So why not tap on those? And the United Nations also has increasingly recognized the importance of the role faith-based traditions have played. And I was recently reading something very interesting I never knew earlier, that 10% of the world's wealth actually is with faith-based institutions. Though we talk about 1% versus 99%, we talk about the billionaires and the multimillionaires, but faith has got tremendous resources, and it is not simply material resources. If you bring in the spiritual resources, then there is nothing to match religious communities, initiatives, their passion, their ability to motivate, their ability to help us overcome struggles. So once again, with deep gratitude in my heart, I'm happy to be here, and I thank sincerely. And of course, my spiritual sister Subiji is always very much, committed. When she takes up a task, she makes sure that it's brought to its fullest logical conclusion. So the URI family, so I hope this manual will surely go a long way, and everybody who has contributed, I sincerely thank them, and let's hope that we are able to reduce the harm. Nobody gets an impression of any kind of punishment or being penalized, but look upon the community as a source of great support and continue with life, because there is so much more life has to offer. Thank you very much.
Thank you, sir, for your very candid speech, as usual. I just want, some thought hit my head just now, and it was to do with the ongoing American election debates. Did you watch the debate this morning?
Yes,
yeah. So one very interesting thing that was discussed today was the American legislation, the American policy on drug use, and one of the two candidates talked about why drug users should not be in prisons but be having better access to healthcare. I think that made my day. Till this point, we were not so excited about, in my family, we were not so excited about the debate, but until this morning when we heard, and here we are, it's some sort of a influence maybe coming out of this Faith for Harm Reduction campaign, reaching that far. Anyway, we'll move forward now, and I would now request Ma'am Anu Kalraji. Ma'am, you so nicely blessed the event, and it's your turn to now share, as candid as Dr. Merchant, on our Faith for Harm Reduction campaign.
Thank you very much. I don't know any other way than to be candid, so don't have to specify that. Yeah, actually so much has already been spoken, and I kept thinking, what is it that I truly believe in that I can share, which can make each person feel more committed to this task? And I remembered a principle in Kabbalah, which says that life had to show us a mirror, and it breaks that into 1,000 pieces and spreads it around us. And every person we encounter, we are seeing ourselves in them. So every time a judgment arises in us about somebody, it is a sign that we carry the seeds and the potential for the same shortcoming within us, which is why we get to see it. So when we sit on a high horse of judgment, thinking, I am going to change the world and I am going to make the world a better place, I think we really have to make ourselves better, which is why life has accorded us this opportunity. And if any of us think this is something charitable that we are doing about treating people better, it's not. We are all here to transform. And how better to transform than to support the transformation process of those around us. So therefore, each one of us has to see within us, what are these seeds that would probably lead us to these kind of problems. Knowing that we are all one, and we are all here just to discover that oneness. And if my brother, my sister, anybody who comes in my purview is not being able to find that source of oneness and that joy of being within them, and it is getting denied to them so much that they need to take recourse to such ways to numb and dull their pain, there is something wrong with the world we are co-creating, and we need to keep creating better, and we need to keep doing better. About manifesting the best within us, then we shall also help manifest the best within everybody else. And that is where faith begins. Thank you.
Thank you so much, ma'am. Okay, so we have last three speakers, and we'll be joined live by Honorable Salman Chishti ji from the Ajmer Sharif Dargah, a very favorite speaker also on behalf of the community. I can tell you that he's been very liked for everything he says for the community. And I'll request Subi to connect us to Salman ji.
Greeting of peace, Adab, Namaste, Sat Sri Akal, and lots of duas and blessings from Ajmer Dargah Sharif to all our friends, our colleagues, our spiritual elders. आप सबको बहुत बहुत नमन, बहुत बहुत सलाम और बहुत दुआएं. As today is a blessed Friday, and that we all come together to address not only a problem, a challenge that we all face in our society, but at the same time, it is equally an opportunity for us to re-emphasize and reassert the importance of our faith-based action, spiritual practices, which are not only a formal presentation of our faith, but it is also an integral part of our daily life. As Swami Lokesh Muni ji and other spiritual elders who just spoke before me, he rightly mentioned that before the start of every day, millions and millions of people across India and of course around the world, they start their day with visiting either a temple, a mosque, a gurudwara, a church, or any faith-based place, a sacred space within their home or even around this in the neighborhood where they live. You know, platform like URI, Global Fund, Alliance for India, Parmad Ashram, and all the different platforms around which we regularly come and speak and share these views. They carry this message to the masses, and especially the youth which is connected to the URI North India and Afghanistan chapter. The UN has also acknowledged the importance of faith leaders, faith-based initiatives to really initiate harm reduction and substance abuse, which has really worked well. And I think we should always come together as a platform to acknowledge. And I think all faith-based places have those facilities and those infrastructure. So we wish all of you lots of blessings and duas, and seek your blessings and duas of the spiritual elders and all the participants in this event that we have come together. From Ajmer Dargah Sharif, Friday blessings, lots of duas, and we look forward to share our platforms in Ajmer Sharif. If any such initiative comes through URI, as we have mentioned 2 years back when we were all together in New Delhi at the UN India building.
So thank you for getting me on, and of course pranam to everyone who's here, and the wonderful work that I'm seeing is happening, has happened, and a big congratulations to all of you for finally getting this manual out. I know it's not been easy. I've seen some of the work that you all have been doing, and it's really, really great. So congratulations on that. As far as, Srimad Rajchandra Mission Dharampur is concerned, I just want to tell you how strongly we support this movement of compassion, because we do not believe that compassion is something that is reserved for any kind of certain people or any kind of certain life form also. So as far as compassion is concerned, it cannot be allowed as stereotypes for some areas or some types of people. So for a person that has already submitted themselves to, drugs, and they're already a vulnerable part of our society. And we all know that as soon as they get into the area of drugs, they become far more susceptible to mental health problems, to physical health problems. And one of the biggest problems, Pujya Gurudev Ji says, Socrates has said in the past, I'll say it in English, that knowledge is virtue. And I'm seeing, as I'm seeing your efforts as well, is how much effort you're working on to create more awareness, to increase knowledge. And only then will this knowledge become compassion. So a lot of y'all have been able to get closer to people who are using drugs. But a lot of the stigmas that have been created is because of the distance that society has created around drug use and drug users. So I just want to really, really encourage not only this manual, but also the magnification of the knowledge that you have collected in this manual. Because I'm seeing as a core issue is awareness. There is a huge, I'm saying this for a lot of people that I meet when we're traveling. There is a very low level of awareness of drugs, drug users, the background of drug users, how to support drug users to truly support them. And we're, of course, in this society, we're seeing, as you've already said earlier, I think Kishore and a lot of people you said about how there is very little funding. And I think that is there because the awareness is very low. So I just want to stress, and I want to give my support and pledge my support for supporting any kind of awareness, any kind of knowledge, even in our own areas here in Gujarat, in Dharampur, in Bombay. We've seen that the more the awareness that we created, the more we were able to connect. As Pujya Gurudev Shri said, till we don't connect, we will truly not succeed in correcting. So again, awareness has been a big part. Already, so many of y'all are doing such great work, and we are also honored to work, to have a lot of our factions in Srimad Rajchandra Love and Care work with a lot of tribal groups, which are very, very moved away from mainstream society, just because they have not been brought into mainstream society, that they are suffering. So it has been our effort to bring them into mainstream society, to create awareness of their lives, as well as the options available, the medical facilities available, and kind of just embrace them within the folds of our daily lives, our daily societies. So yes, again, the social stigma and a lot of, if you can create a lot more awareness. Already we're seeing so lovely to see, people like Global Fund pledge their support for the wonderful work that URI and Harm Reduction Group and everyone is doing. So again, on behalf of Srimad Rajchandra Mission Dharampur and Pujya Gurudev Shri, I just want to pledge my support, as well as urge all these factors, all these actors to please support this work and support a marginalized community in everyone's welfare. Because as Salmanji just said, as far as faith is concerned, one of the bases of faith is compassion and unconditional love. So let's create more cultures around unconditional love and let no one be left behind. Thank you so much.
I also take this privilege to extend all the support from Art of Living Foundation and Pujya Gurudev Ravi Shankarji. One of the guiding philosophy of Art of Living is Vyakti Vikas, right? And when we say Vyakti Vikas, we are interested in each and every person without any discrimination. And having this kind of initiative, I know will go a long way and to remove the stigma, which will further pave way for people who are suffering from this illness to access the service and access the services with all the honor and dignity which they rightfully deserve. So again, I would like to congratulate, extend best wishes on behalf of Art of Living Foundation and from Pujya Gurudev Shri Ravi Shankarji. I would also like to seize this opportunity to basically inform the House or all the distinguished panelists here that we as in Art of Living has a dedicated and a dedicated program called a wellness program for substance users, wherein the main focus is mainstreaming, removing stigma, and basically creating awareness so that the issues related to discrimination and stigma can be taken care of. So let me close my remarks by again assuring all the help and support from Art of Living Foundation, and congratulate and extend best wishes. Thank you.
Thank you so much, Deepakji. Next time we should have you in person. We are missing your presence here. We should have you in person. But thank you nevertheless. And as and when we do the first program after the launch, we really hope you will be able to join us and share your profound views. So,
I would like to say that I was yet unaware about the huge stigma associated with drug abuse, and I was quite surprised and even shocked to know that this social stigma prevents them from going out and accessing healthcare, which even worsens their condition. So I congratulate Yuri and all the participants for your untiring effort and for bringing out this Faith for Harm Reduction manual for greater awareness for all of us. And why I think religion can play a huge part in this campaign is because a common aspect of all religions, including Islam, as all of you have nearly touched upon, is to not live for yourself, but extend a helping hand to others in need, especially when you have the resources and blessings which others don't enjoy. And in Islam, in particular, helping those who have sickness and visiting the sick are actually religious duties enjoined in a number of sayings of the Prophet. And in the context of this campaign, we all know that drug usage many a time stems from psychological problems, mental trauma, even isolation. So religion can play a role, can play a part, as its teachings can provide solace to the affected people. And we can say that religion can address the root cause of this phenomena, as Dr. A.K. Merchant was also saying, and faith leaders can come out and be physicians for the soul in distress. And as Ms. Anu Kalra ji was saying, even our organization, Center for Peace and Spirituality, is focused on bringing the change within us as individuals. And once that happens, this spark is bound to not remain restricted to itself, but to shine its light outside on others as well, by helping them to rediscover their strength, their mental strength, and find meaning in lives. So we pray for the success of this very important social campaign. We all need to come together definitely as champions of this noble cause. So thank you once again for giving me the opportunity.
and most important part, because this manual, of course, we heard everyone who's been in the forefront of developing this manual, but there are a lot of young, very important people behind the scenes who often don't get as much acknowledged as do people in the forefront. So there are a number of people from URI, there are a number of people in Alliance India, there are a number of people from the faith partnerships behind the scenes who have played an equally important role, and they need to be acknowledged along with everyone else. Before I hand over to Subi, I also wanted to acknowledge the presence of two important colleagues, people here. We have a very important friend here from Religion World, Mr. Bhavya. Thank you for joining us, Bhavya. And we have Ms. Rose Nara. She is the Associate Director of Alliance India. Rose is very important because she runs the world's largest care and support program for HIV positive people. So, welcome to you both. Before I invite Subi to finally do the vote of thanks.
So as a vote of thanks, I'm actually quite speechless right now and very overwhelmed as well, because since the past 3 to 4 days, we've been really trying to put things together along with Alliance India and the College team. And I've been thinking about what should I say when when the event comes to a close. And nothing really actually came to my mind because for me and for our entire team that's been behind this, we only see this as a beginning to a longer journey. We only see this as a part that this set is coming to a close and the entire book is yet to be written. So with those words, I just like to thank, if I have to actually go deep down, we've been over 70 plus people just trying to put this only book together. And some of the key authors who've already spoken now and organizations who've been with us this morning, I still like to think and extend a very, very hard gratitude to Percy Parmar, who has been such a strong backbone and the main platform for this for the second leg and always for the entire program. I would also like to thank Srimad Rajchandra, Akshar Dham, Bahai State, Syed Salman Bhai, from Gautam University, Dr. Arvind, Sunita Ji, Anu ma'am, Vinajna, who's been the main editor to this entire book. We also have Tanya, Kripa, Sharanya, who've been at the forefront of putting everything together. I definitely don't want to miss on a few people who've been constantly in touch and help us move forward. Some of them have been Dr. Ranveer Singh, Dr. Savli Kateshwari, Father Victor Edwards. We also have a global program like Maria Crespo, who is very instrumental in helping us with this. Rashmi Shetty, Sanjay Sharma from the Art of Living board. Vasudhai will, without whom we wouldn't have been able to put a lot of our chapters together. I'd also like to thank a few very important faith champions who've taken up the charge of starting something as controversial, difficult, of giving science and religion through this program. And amongst them, would like to thank Ahimsa Vishwa Bharati, All India Organization of Imams of Mosques. Then we have Caritas India, we have Vijay Jyoti Sansthan, we also have Mata Amrita and Dr. Train. Would like to also thank Gurudwara Bhagya Sahib. Unfortunately, there was some technical issue with the video, and so hence we could actually play at this point in time. However, I'm sure he is, we're all close to his heart at this point in time, and he's there with us at the moment. The Office of Women of the Holy Exam and the Temple of Understanding. So the list is like really, really long. Dr. Brian and Dr. Kumar now have actually brought the very important scientific dimension that was very important to ground this entire manual. Last but not the least, I would like to thank my global head office, who's been encouraging me to explore, push our boundaries, and also look at a very important part of where and how we integrate faith-based organizations in the business and communities to bring about the social change. And taking up something as difficult and challenging such as this probably comes from inspiration from our founding president, Bishop William Swing, who is actually the one who set up the HIV/AIDS program at the Grace Cathedral in San Francisco. And of course, this wouldn't have been possible without the India HIV Alliance team, Kira Kunal, and others who constantly been there through the ups and downs and